Now I would like to introduce our speaker, Adiasha Richards-Thornhill, a licensed mental health counselor and the owner of Growth and Transitions Counseling. Adiasha, you may now have the floor.
Thank you for the introduction. Hi, everyone. Thanks for joining today. Excited to be able to present a little bit about trauma and talk about trauma in the Black community and focus on mental health. I thought I'd start just with a little bit about me so you'll know some of my background. I am Caribbean born. I am from Trinidad. I grew up in Queens. The beach is my happy place. For the pandemic, I've been blessed to be able to spend it in Barbados. And I love to travel. I've been to many Caribbean places throughout my travel experience. I started my practice when I was 29, and I've been in the mental health counseling field for 10 years. I myself personally went to therapy on and off from 16 to 28. So what is trauma? Trauma is events that overwhelm the body, altering the way that we process and recall memories. I love this quote that says, "It isn't the story of something that happened back then. It is the current imprint of that pain, horror, fear living inside of people." So the way that we kind of define trauma in the mental health field is it's some sort of event that have occurred in your life that has caused, significant impact. Traditionally, trauma was mostly associated with PTSD, thinking back to people returning from war and the experiences that they had while in battle and the things that they've seen and experienced. Mostly it was thought of as life and death events. The definition of trauma in the psychological field then kind of evolved to starting to include events that happen to children, such as abuse, neglect, dysfunctions within community settings and within childhood environments. And it's just continued to evolve over time. So the way that we think about trauma, just going back to that quote, is that it's not the thing that happened back then. It's really the way that your body recalls and your mind recalls those memories, how your body processes the thing that happened back then previously. So most people that have had trauma may present with triggers at times. Sometimes they may have flashbacks. It presents, in their bodies. Sometimes people that may manifest into anxiety, a lot of tension in the body, things like that is the way that trauma can look like. Intergenerational trauma is something that we hear a lot about, I think, these days. And so that is the functional and dysfunctional attitudes, behaviors that have been transmitted to us through multiple generations. The behaviors that we are now transmitting to others in our environments of home, school, work, and within the larger community. So if you think of intergenerational trauma, you're thinking about the things that your grandparents, their parents, your own parents have gone through. And so those things and those experiences, and again, the way that it is processed and recalled in the body and the manifestation of whatever it looks like, then gets, passed on and transitioned from generation to generation. So, there are people who say the way that they function and their attitudes and their values, yes, they go back to a certain time. And as generations continue to experience trauma and respond to those traumas, then it continues to get passed on, and trauma can evolve in that way as well. So some of my favorite trauma quotes, one of them being, "We repeat what we don't repair." So that one, I really like just thinking about, many of us, I'm sure we have those moments where we see things about ourselves and we're like, I can't, I find myself, I'm always attracting, unavailable guys, or I'm always getting used in my relationships. People take advantage of me. If we don't figure out what is rooted in our behaviors and we don't repair it, then those cycles will continue to present itself in our lives. So you'll continue to, attract the unavailable guy. You'll continue to find yourself in friendships where you feel taken advantage of and You're giving more than you're receiving if you don't repair the reasons why those behaviors exist in the first place. The other one, unlearning abuse, also means unlearning the abusive behaviors that you inherited as survival tactics. Um, it's part of trauma work is learning how to unlearn some of the things that you've experienced. So, like I said, in you know intergenerational trauma or just some of the things that we experience, then we pick up certain behaviors, right? Behaviors are things that are learned and modeled in our environments, from our parents, from our role models, the people around us, and sometimes we also pick up negative behaviors that are not good for us. But if you grow up in an abusive environment, you may pick up, maybe yelling or aggression as normalized, but that's not necessarily a good thing. And so you have to unlearn that. When it comes to trauma, we all react to it. And those reactions tend to be very survival because, again, traumas are things that are, like I said, if you think about like a life and death situation, then you're going to go into survival mode as opposed, as a response to it. So all of the traumas that we experience are very similar to that, where you go into some sort of survival mode, and the survival mode that you go in that moment does not necessarily serve you moving forward. So if you're getting into a fight, for instance, and you go into survival mode, you're going to like fight or flight. If you decide to fight, then that fight would happen in the moment only. And then once the threat is over, then you're no longer going to fight. When it comes to trauma, our mind doesn't ever come out of the fight mode. So that is the difference between mental health and emotional trauma than if you were in some sort of physical event that happened to you. So people that experience trauma in regards to their emotional worlds and their lives, the survival things that they pick up out of those traumas, they don't ever let them go and they don't stop doing it. So they stay in kind of fight mode. And so that's part of the negative attributes to trauma. The other one, learning to differentiate between the sound of your intuition guiding you and your traumas misleading you. So, like I said it just now, like traumas will then manifest into survival tactics and survival mode that will then create behaviors. And a lot of those traumatic things that are embedded in us tend to mislead us into reacting and responding to situations in negative ways or in the wrong way. And sometimes they're very subtle and they could be very unconscious. A lot of people may not necessarily be aware of the things that they do out of their trauma, but it exists. And so whether you're consciously aware of it or not, it is happening. And so part of the work that I do as a clinician is to help people work through their trauma and then eventually getting them to a point where they're able to differentiate like what is a trauma-based response versus your intuition, healthier behavioral responses to the things that they're experiencing. Your wound is probably not your fault, but your healing is your responsibility. So many times I think that we meet people that experience whatever it is they've gone on in their lives, and they tend to be like, well, I'm like this because that happened, I'm like this because my mother wasn't around, I'm like this because I grew up in these surroundings, something has happened. So those are their wounds, and those wounds are very valid, but we can't change the wounds, we can't change the past. And so healing is essentially individually each of our responsibilities to decide that we don't want to be stuck, and we want to be able to move on from those things that we've experienced. So like I said, I think trauma work is pretty challenging, and change is challenging because we all try to work on improving things in our lives, and there's things that we want to accomplish, but when there are traumas rooted that are barriers to our success and to us being able to navigate the world in a healthy way, it can be really challenging for people to be able to uncover, work through. And when bad things happen to us, we don't want to go back to those things. We don't want to relive it. We don't sometimes want to talk about it or deal with it. And in my work, I think that we find a lot of the traumatic things that people have experienced, they try to bury it so much because they don't want to think about it. But even if you try to lock your traumas and the things that you've experienced in a, you know, behind whatever door, it does not stop your survival tactics. It does not stop the way that it manifests in your life. And so you're going to be dealing with that trauma whether you like it or not. And so when people usually come to therapy, it's because trauma is affecting their lives so much that they can't function in their relationship and their work, or they're unsatisfied with life. They're not happy. They're finding themselves very depressed or anxious about things. And they've come to the realization that unless they address these traumatic things that have happened to them, that they're not going to be able to lead lives that are fulfilling. And so that is essentially rooted in why trauma work is important to me, because I don't think that people should have to feel stuck or not be able to live happy lives and peaceful, fulfilling lives because of things that happen to them that a lot of the times and the majority is not any of their fault. It was not, they didn't do anything to put them in those into those situations and experiences. But seeking a therapist, working with a trauma focused therapist like myself can help make that healing your responsibility and help guide someone through that healing. So we are here to talk a little bit about trauma and community of color, and specifically in the Black community. So trauma dates back to slavery. Slavery was a traumatic event that, all Black people, regardless of where they come from, have experienced in some way, shape, or form. Their ancestors have. And so if we think of all our ancestors and our lineage starting in such a huge traumatic event, that there was no support, that is not acknowledged, that is not cared for emotionally, then there was, I think, the root and one of the root wounds of trauma in the Black community being slavery, because then our ancestors had to be in the survival mode, reacting to the trauma that they experienced in survival mode to be able to move past those things. And their traumatic experience was not validated, acknowledged, not supported, not processed. And so whatever behaviors they developed in survival mode out of slavery then starts being passed on generationally to where many of us may be today. Poverty and violence in communities is also another way that trauma presents in Black communities. So, if we know of history of, communities of color where, there's less lower economic status, there's, less resources, less opportunities, there may be higher occurrences of violence. And so, if you're living in a community where you're experiencing violence, which brings about fear, which again puts us back, like I said, in that fight or flight kind of response, right? So I think it's pretty understandable if someone's growing up around violence a lot. They learn how to survive in that violent world, and it may not necessarily be good things that they learn how to survive, but either way, they have to figure out how to survive. Same thing with poverty. And in communities with low economic status, right? You learn how to survive in those things. The parents that had to work 2 or 3 jobs, the late hours, leaving your kids at home while you got back. One way that trauma manifests in those situations is that children become what we call parentified in the psychological community. So if you're a child that, sometimes we meet people, it's like, oh, I had to grow up really fast. My mom worked really late, so I, came home from school and I had to make my own meals, and I had to take care of my siblings. That is not a normal thing. And that is something that's being passed on because the parent is experiencing their own traumatic environment due to whatever circumstances and low economic status that they may be a part of, which results in them having to work more and be out of their home more than they would like to be, then making that child then have to grow up faster than they need to be and taking on adult responsibilities. And then that just continues to translate. So now that child is going to develop their own survival mode because of what's going on, where maybe they're overly independent. That sometimes can be a manifestation of trauma. I had to do a lot of things on my own. I had to figure it out. There was no parent home for me to be able to navigate these things. And so then these things continue to evolve and pass on. Currently, of course, we're still, living through this pandemic, which many feel is also an additional traumatic experience, the being stuck at home, our lives changing very abruptly, the fear and anxiety out of COVID-19, the rapid and the amount of loss that people are experiencing, not just in personally, but also just in the world. Um, there's a lot going on for people. There's a lot of triggers. It's really challenging time for many people right now. For those that already, were in difficult spaces and struggled with their mental health. For some, this pandemic is now just an additional trigger on top of it. And when we think about Black people and people of color, then we have the racial trauma. So all the things that have been happening. And prior to the pandemic, of course, the gun violence, the police brutality, all the Black lives that has been lost. And then the things that continue to happen, even as we went through this year and the pandemic, continue to be triggering to Black people. Racial trauma is a very, particular and kind of special kind of thing, because we think of other forms of trauma, maybe, childhood abuse may have ended, right? So someone may say, like, I was abused between 9 and 13, or I had a traumatic experience where I was sexually assaulted, but that thing has started and ended. The unique thing about racial trauma is that it has not ended, and it does not end, and it has been continuing throughout our existence. When you're born into the world as a Black person, you come into it automatically, being attached to all of these things that happened way before you and continue to happen in the world. The way that you're targeted racially, the separation gaps, in all our different environments. That we experience, the privilege that separates us from white people. So the impact of racial trauma is very different. Many people are very, people of color are very angry. It's a constant fear. There's a constant worry when you have to, have conversations with your Black boys and Black men about, going outside and, just getting home and their environments. There's an underlying fear and worry that's rooted in that response and why people have to do that. And so for people of color, these things don't go away for us. There's no start and stop point to the trauma that we experience when it comes to racial triggers in our world. I started to talk a little bit about intergenerational trauma. Just wanted to touch base a little bit about some of the ways that it just kind of presents itself over time. So remember I talked about those survival mode things, right? Emotional resilience is a part of, Black experience. We think of ourselves as very resilient for the experiences and things that we've gone through, which is a good thing. However, trauma occurs and remains trapped in the body. And so regardless of how resilient we are, and the idea of resilience in the Black community is often tied to being strong, right? Because we've been able to overcome things and we're here, we keep going. It's like this push through kind of mentality. But that doesn't address the trauma that has actually occurred. And so no matter how resilient we may be, without addressing the trauma, I like to think of trauma as something that kind of catches up to us over time. If it is not addressed, there's only so long you can ignore it. There's only so long. If you think about the closet that you keep all the stuff that you don't want to get rid of, but you don't really want to see, where oh, well, my room is clean, but I have all this stuff in the closet, and then eventually that door can't close. So trauma is like that. You can try to pack away those things for a really long time, but eventually the door won't close anymore. and you will have no choice but to address it. So protective mechanisms are things that we do, again, to help us survive and to get through the things that we're experiencing. Sometimes those protective mechanisms no longer serve us. So again, in Black communities and environments, whether it's like negative self-talk and telling, boys that they shouldn't cry, that they need to be tough, that may, help them navigate some life experiences, being in the street or looking tough. But now there are many men that don't know how to connect with their emotions. They don't know how to express themselves. They're not very emotionally intelligent. And so, yes, that may be created out of being a protective mechanism and survival about things that were going on in their environment, but it doesn't work. It's not going to last, forever. Numbing of feelings. So to stay strong, push through, just let it go, get over it, stay positive, those type of things that we do that's very dismissive of our emotions are not healthy for us. Our emotions need their space to be processed and dealt with. And when we don't do that, unfortunately, again, they manifest in our depression and our anxiety and other mental health issues at times. And just the way that we show up in the world, we're not showing up in a very healthy way. Um, Religion is a very important value in many Black communities. Thinking back to slavery, also religion, turning to God was definitely a way that people kind of cope through the things that they were experiencing. There's a space for religion and God and mental health to occur together. So there are people who grow up and experience very religious households where they're told to just pray about it, or to just turn to God, but that doesn't necessarily actually teach them how to work through the things that they need to or how to cope. I think religion and spirituality is a coping tool, but it's one of many, and it cannot be used in isolation without others. And it's also sometimes not effective, without others and without, other processing and mental health. So those things are also passed on. Transitioning a little bit to Caribbean trauma. So like I said, I was born in Trinidad and moved to the US as a preteen. And so understanding the trauma associated with people in Caribbean communities has been something that's also very important to me and my work, depending on, different environments and places and cultures that we grow up in. Like some of our traumas are very similar, but it can also be unique in some ways. So I know for me and around, Caribbean counterparts, migration has led to its own bit of trauma, for us. So in Caribbean communities, there's a time where a lot of parents were migrating to the US and leaving the children behind in the Caribbean. I was a child that happened to. And we're left to be raised by other family members or sometimes someone in the community and things like that. And so it creates disrupts the connection and the bond with parents, which is really important. And so there's a lot of trauma that may be associated with that. I know for me, particularly, that left behind a lot of abandonment issues, a lot of emotional detachment, when it comes to my mother, and she was the one that left the Caribbean. And so till this day, we struggle emotionally, which may have been different if she was, physically present while I was growing up and we didn't have, we were separated for 8 years because of migration. And so that's a really long time to be away from your birth parents for the sole reason of moving for a better life. And it becomes challenging in Caribbean families and households because that act is seen as an act of sacrifice, which is completely understandable. And it's an act of care for, trying to be better and trying to give better to children. But at the same time, the impact of it is not addressed, not always validated, which is that, yes, you know, you may have moved to another place and may facilitate a better life in some ways, but the separation still has to be addressed, and what has occurred during that separation um, still needs to be addressed. So migration was definitely one of those things that impacted Caribbean communities, the impact of colonization and the slave trade. So I spoke a little bit about slavery. Similar things happen in Caribbean and, you know, Latin America, all of these things, colonization, a lot of those islands being colonized by, you know, British, Dutch, French, depending on where you go in the Caribbean. They've been ruled by some different entity, European entity, you know, maybe at some point. And so um, those, you know, that colonization have impacted, because colonization took a lot of the resources or impacted the islands in that way, then, you know, a lot of islands have a lot of poverty, and there's a huge economic impact, you know, in the Caribbean. Um, and so, you know, those things are still being dealt with and impacted till today. Domestic violence is a big thing, you know, issue at times in, you know, Caribbean communities and relationships. So that's something that impacts many people and families. Um, Caribbean people don't really talk much. I think most Black people will probably identify with that, where, you know, you grow up where it's keep your business in your home, don't tell other people what's going on, you know, kind of keeping secrets, keeping the family secrets together, not being open to talk about the things that we experience. So you're taught to kind of stuff your feelings inside, that you don't get to open up and talk about it. You don't get to cry about it. Like, things happen. I know for me, growing up in a Caribbean household, it's like, you know, we can argue today and it's like all the things that I can't stand about you and all the things that went wrong, and have a big blow up about it. And then tomorrow we're going to pretend like it didn't happen, and we're just going to move on. And if we don't talk to each other for a while, we don't talk to each other for a while. And then eventually maybe we'll see each other, or if we live in the same household, but we're meant to just keep moving, you know, and that thing never happened. Um, Child sexual abuse is also something that impacts Caribbean people a lot. You know, I've talked to and have met many people in the Caribbean who have stories of sexual abuse as part of their trauma. It's also sometimes a bit concerning, because men in the Caribbean don't always see things that have happened to them as abuse. So, you know, you'll meet a lot of Caribbean men who lost their virginity at like really young ages, you know, 8, 10, you know, sometimes by someone who's older than them, maybe significantly older. But they see it as like a rite of passage rather than this being a sexual abuse or sexual assault. And then, you know, also a lot of young girls will have same thing stories, you know, losing their virginity or having sex with or being in relationships with men that are a lot older than them. And so that's also some things that I explore a little bit. So this, you know, presentation just talking a little bit about trauma and understanding like what are the barriers to Black healing. And so as we talk about, you know, trauma and identify like what it looks like in the mental health community and how it impacts your mental health. So like I said, you know, something really important for me that I share with people a lot is that mental health isn't, you know, always about the diagnosis or the serious persistent mental illness. It's not about the people that, you know, have the bipolar or just the schizophrenia, or the people who are severely depressed and suicidal. Mental health can manifest itself in many ways. It's really more about mental wellness and being well emotionally. And, you know, for me in my practice, I see many people who you're friends with, you know, as your family, people you work with, who on the outside are deemed very well, you know, they're educated, you know, they may have good jobs, but you don't know where their wounds are and the things that are going on. And so someone can present in the greatest of ways, you know, and have gone to college, you know, in med school, whatever, and they can't have a relationship. You know, they're going serial relationships. They're scared of relationships. They're scared of vulnerability. I meet people who really fear opening up. who have a hard time with trusting others, who are not able to express themselves and assert themselves in situations, who just don't know what healthy relationships look like and they keep choosing really negative ones. Those are all ways that trauma manifests itself, right? The overly independent, like I said, I don't trust anyone. I have to do it all myself. The type A personality sometimes. It can be the people who are just like, they're always in a relationship. They don't know how to be alone, right? They're not comfortable with being alone. People who are very like anxious to like lose their partner, who tend to be very codependent and needy in relationships. These things are not, they may not show themselves very much, on the outside, right? You may not see it on a day-to-day. It may not look like anything to you, whether you're experiencing it or to others. It's not the thing that lands you in the hospital. It's not the thing that needs medication. It's but they affect you, but they're barriers to your life, to your success, to your well-being. And that's what mental health truly is are you mentally and emotionally well enough to be able to have the things that you want, that deem important to you? Are you putting too much pressure on yourself when you're in school? Are you someone who are just fixated on milestones? I gotta get to med school, and after med school I gotta do residency, and then this and then that, and then I gotta be married by 30, and then I have to have a kid by 35. Those things, are not always healthy for us. People get really attached to even things like that. I grew up in this way. And so they all affect our mental well-being, but they're not necessarily things that fit into some sort of diagnosis. And so we want to be mindful of those things. Stigma is a barrier to mental health healing, the lack of knowledge. There's limited therapists of color. My field is a very white-dominated field. A lot of therapy and psychology grew out of many white theories and things like that. And so, there's a lot. There's a good bit of me, but not a lot as at the same time. Our healthcare system is very crisis centered. You have to, something drastic and horrible has to be wrong with you. It will wait till the point where you can't go to work and you're extremely depressed, or you can't get out of bed, or you've lost, your job, before it's deemed that your medical insurance is going to be able to pay for your care rather than preventative. And you guys are all, aspiring, medical professionals. And so seeing how that impacts our systems when it's more crisis centered rather than preventative. For mental health clinicians, our reimbursement rates are low for insurance companies. And so, there's sometimes a battle in deciding, do we want to take insurance? Do we want to charge out of pocket? Who has access to care? And so then there becomes these separations and these disparities in who can access care. Is mental health only for those that can afford it and are rich enough or wealthy enough and have money for it? Or can everyone have mental health care? My practice is pretty much 95% insurance based. And so I'm someone that believes mental health should be accessible to everyone. With the balance, of course, that, I have to live and survive and take care of myself as well. And this is my job, and I get to be paid my value and my worth. And so those are battles that we experience as clinicians between wanting to offer care and making it accessible, but also feeling that we're compensated the way that we deserve. And that can also be a challenge. So right now, I'll turn it over to questions and responses from you guys.
And we have a question from the chat. It says, pertaining to the current pandemic, would you say that the lack of interpersonal social regulation or social support has exposed people to their own mental health issues and dysfunctional tendencies more prominently?
Yeah, I would think in some ways that it has. So if you're forced now to be at home or isolated in whatever way due to the pandemic, and you don't have a good social support system or great interpersonal skills, then yeah, it's really challenging right now. You don't have people to talk to, you don't have people to connect with, you have less access to social connections. And even for the people who are very social or are good in that way, it's still challenging for them because the pandemic created a situation where if your normal part of your normal coping and self-care was to be able to like go out and see your friends and socialize, and now you're limited and you're not able to do that, then that's also going to impact you. The pandemic has created a lot of quiet time. So I think one thing that impacts a lot of people is that we get to be very busy, and busyness is a distraction from our mental health concerns and our dysfunctions and our patterns. And so when you have to get up at a certain time and commute to work or school, and then you have the papers and the exams and then the people and it's just all the stuff going on in your life, and now you're sitting at home and you have hours to the day and your commute is no longer there, and classes are shorter, work is less, then you think. And when you think about the things that are that you're unhappy with, you think about the things that are not working, the feelings that you've buried and you've ignored while you're being distracted and busy then start to rise to the surface.
Okay, another question. How can practitioners learn how to provide trauma-aware and centered care?
Good. So for practitioners to be able to address trauma, there's so many trauma focused, trainings and interventions that are present. It's really great to expose yourself to, read and to understand what trauma looks like and how it presents itself, whether that's, reading from books, doing webinars, doing full trauma training. I think it's great. And I hope, as people continue to create, trainings and support for practitioners in all different, disciplines, not just in mental health, because it shows up everywhere. If you are, you guys are working towards being doctors. You're a doctor. Someone comes into your office, you don't know what trauma is coming, with them into that office space. And so it's really important to understand that and what it looks like. I may see someone as a mental health clinician and recognize something, or I'm aware of the way that someone presents that maybe someone in a different discipline will not notice. I also think it's important to collaborate with others and like refer when necessary and make sure that your I call them clients, patients, things like that, depending on your discipline, get care. So if something is not in your field and you don't have the knowledge and experience with it, send them in the right direction. I can't tell you how many times I have clients come to me and they're like, I got prescribed, antidepressant by my PCP or my OB or something. And I think it's important, just because you may be able to write a prescription doesn't mean you do it, because then there's no follow-up care. And if you feel like you need to do something like that, then it's like, how do you then pass that care on to another provider and practitioner to make sure that patients get what they need? So if something is not in your scope, then follow up the way that you need to make sure that you're addressing it and seeking the knowledge behind it.
And following up on that trauma and healthcare, how do we combat trauma in the Black community in relation to the COVID vaccine and gaining trust?
Mm-hmm. So that's another very present one that's happening for many people right now, is around the fear and the worry around the vaccination for people of color. So again, this is how trauma has been passed on because of the experiences of Black people and the lack of trust within our systems, and consistently experiencing situations where have been lied to, or we're not getting the same resources, the same access. It has created a lot of mistrust, a lot of uncertainty, and a lot of worry and fear around the vaccine. I think at the end of the day, it's a very individual decision to make. As I would say with anyone that has triggers around something, talk to someone about what those fears and those worries and concerns are. I think it's going to be, it's a very individual, like personal thing to decide whether to take it or not to take it, or how to reduce those worries and anxieties behind it. So stay informed. If there are, Black doctors and medical professionals that are providing information, seek them out, ask the questions. It's really important to advocate for the things that you need. So speaking up for the things that you're not concerned about, waiting it out, whatever it is that you need in order to feel more comfortable is essential, right? So whenever there's a huge worry or fear, you have to ask yourself, what do you need? And thinking about what you need to be able to address that. And if that fear or something is too much and there's an alternative and it's not something that you feel comfortable doing, and that's okay as well. It's a personal decision to make.
Okay, next question. How can religion and spirituality be integrated into the therapeutic alliance in a way that helps people address underlying maladaptive behaviors and responses?
So like I said, therapy and religion and spirituality can absolutely be combined. So some ways to integrate that, seeking a clinician who may be focused. For us clinicians, we tend to pick our niches. And so you can ask that clinician or seek out or look for someone who has identified certain things that they want to focus on, because they are faith-based counselors and things like that. But then also just seeing how the person that you're working with is open to you. So for myself and many clinicians, we really strive to be curious and to be open to people's experiences and the things that are there. So regardless of if I'm the most religious person or not, that doesn't matter to me. If that's something that's important to you and a way to help you either cope through, then we're going to utilize your religion as a way to help you cope. We can identify ways in which your spirituality helps you. I have many clients who we'll talk about astrology, we'll talk about crystals, we'll talk about essential oils, we'll talk about all different things in the way that they're experiencing the universe, whatever way that assists them and how they feel grounded and connected and supports them in being healthy. And then also how to address, the ways that some of those things may present in a negative way throughout your life. So it can absolutely be integrated. Sometimes it's integrated like in homework. If it is something necessary to have gratitude journals, to attend church, to whatever scriptures that are important to you, and processing them and how they may connect to your behaviors and the way that you're showing up or some of your anxieties and fears. We'll find ways to be able to incorporate it and address it.
Okay, last question. Have you seen any successful implementation of preventative care or trauma awareness in schools?
In schools, not that I can think of off the top of my head, very specifically. I would say in schools, I think it really comes down to their own research, their own access, their own how they seek things out, for themselves. If you know that things are rooted in trauma or there's something that happened to you. I think the best way, in schools, it's usually, again, collaboration. So whether it's a school counselor or teachers or things like that, if they're able to refer their students to care. Colleges have, mental health and counseling centers. Probably that would probably be the best place where it would be effectively implemented, because a college counseling center can implement and utilize trauma-focused interventions or hire trauma-focused clinicians to address things. I think in elementary, if you think about other forms of schools, so elementary to high school, that could be a little bit more challenging, really depending on if the specific social workers or school counselors in those environments have been trained and focused. But just certain schools have very high value around mental health and focus. There's been a lot of school-based programs in New York City, I think, to address that. So whether they're connected to, I've worked in agencies where we provide counseling, and then we've had school-based programs. We've had clinic and community-based programs and will connect with schools and as such. So that way there's a very immediate link where the school can get help and trauma-focused care and clinicians to be able to address those issues. I would say those are the places that it's probably, I've seen it implemented in a way that is effective when there's like a very direct link to the resource.
Okay, thank you all for joining us today. And thank you so much, Adiasha. This is a wonderful presentation.
Thank you so much, everyone.